One field where they've done that is in medicine. More than 36% of the doctors in America are now women. And as we begin Women's History Month this March, women now make up a majority of medical school students.
That's right. And so we're going to find out some more from Dr. Jennifer Meares. She's a cardiologist and senior vice president of the Center for Equity of Care at Northwell Health. So, Doctor, good morning. Thank you so much for being here.
Good morning.
Good morning. A pleasure to be here.
It's great to see you, great to have you, especially on this topic. We've definitely felt the importance of having women in the medical field during the pandemic, and especially as we look at the rates as they pertain to maternal health. As we talked about women now comprising such a large portion of folks in the medical field, how has the increase in female physicians really changed the healthcare landscape in America?
Well, and thank you for having us on. I think that because we have more women in medicine, we are now making progress in understanding and studying the unique needs of women. And at the Katz Institute for Women's Health at Northwell Health for the past 10 years, we have been on the journey of revolutionizing how we look at women's health. And this is important because for many years we followed the male model of treating all diseases. And we know, especially in heart disease, that women have an array of symptoms that can be different from men. So I think having more women in medicine, and we have definitely now focused our attention in expanding the way we treat women for many diseases, heart disease, liver diseases, all of the diseases where women show up with probably an array of symptoms and can be underdiagnosed, undertreated, symptoms recognized, we are making progress.
I love your energy. And we were just talking about women's heart health. Everybody wore red to raise awareness for it. So let's talk about that specific area, because in the area of cardiology is one area where the numbers are still not where they should be for women in your field, right? Only about 16% of America's cardiologists are women, and only 2 other specialties have lower percentages. So why do you see that?
Well, I think that, we have followed a very sort of rigorous training model in cardiology and in many of the surgical fields that did not attract women. We were sort of, not friendly to women's lifestyle and did not attract women. It was not conducive to women going into cardiology. We are working to change that by having more women as role models. At Northwell Health, we have a large percentage of female cardiologists. My colleague, Dr. Stacey Rosen, who heads the Katz Institute, we were sort of early trailblazers, and then attracted many more women, Drs. Jean Cacciabato and others, who joined us. So I feel that we are changing the culture of cardiology, working with the American College of Cardiology to really, understand how to make cardiology much more conducive, recognizing the vital contributions that women in cardiology and women in medicine make for us to understand and expand how we treat our female patients and all patients. And I would say that we know that when women thrive, communities and families thrive as well.
Absolutely. We see it time and time again. Dr. Meares, do you think the relative lack of female cardiologists, do you think it's had an impact on the overall heart health for women?
I think up until probably 2 decades ago, yes. Because when you look at the numbers of women dying from heart disease up until probably 2.5 decades ago, more women died from heart disease than men. Approximately in the mid-90s, female cardiologists, especially Dr. Nanette Wenger, Dr. Noel Barry-Merz, who you see there, spearheaded sort of a movement for us to start studying, doing research to understand the different needs of women and how heart disease presents in women. And since that time, we have seen the numbers of women dying from heart disease decrease. The American Heart Association teamed up with all of us to really launch the Go Red for Women movement. And so we're studying the science, we're raising awareness, and we're seeing the numbers decrease. I will say, though, a caution is that we have hit a plateau, and now we're seeing younger women showing up and dying of heart disease. So the awareness needs to continue. And I will answer the question by saying, because we have had women sort of leading this revolution, and interest in understanding women's unique needs, we are seeing results.
Dr. Meares, before I let you go, we have to hurry up here, but I do want to point out you actually wrote a book. So if there's anyone who is doing their part, it is you. Quick tips on how women, especially women of color, Latinas, how they can really take control of their heart health. The first one you say to stay active. Why is that so important?
So, so I would say, and thank you, the book, Heart Smarter for Women, written by, co-authored by my colleague, Dr. Stacey Rosen, who heads the CATS Institute, is a CATS Institute for Women's book. And we wanted women to take simple steps to translate what we know about preventing heart disease into action. Exercise, doing some sort of activity, choosing to move every single day, up to 150 minutes a week, decreases your risk for heart disease. And this is research from the American Heart Association. So get out there, walk 10 minutes at a time, let it add up. And we know that blood pressure is better controlled, diabetes is better controlled, anxiety, and all of many of the factors that affect heart disease in women better controlled with choosing to move every day.
All very good. I like that last one too, which was sleep more, stress less.
Yeah,
if only it were,
work on that.
only it were that easy. Dr. Meares, thank you so much for being here this morning to talk more about this.
A pleasure. The journey continues.
I love your energy. Come back
Thank
soon,
you.
okay?
And check out the CATS Institute for Women's Health for more information for all women.
Absolutely. Okay,
Fantastic.
thank you so much.